My name is Benjamin Haithcock. I'm the Section Chief of Thoracic Surgery. I'm also the Surgical Director of our Lung Transplant Program. I'm also the Residency Program Director for our Integrated Thoracic Surgery Residency Program. And I'm an Associate Professor of both Anesthesia and Surgery. Well, I became a doctor because I liked helping people. My initial thought was that I wanted to become a chemistry teacher. I also thought about kindergarten teacher as well. But I really was fascinated with the workings of the human body. I was interested with how things worked. I used to take things apart and put them back together again. And I taught for a little bit and realized that I thought I was best served as actually a surgeon instead of a teacher, more specifically more of a physician instead of a teacher. How I became a cardiac and thoracic surgeon was actually through a pretty long route. During my medical school training, I realized, pediatrics was not for me, psychiatry was not for me either. And so during my third year clerkship, I performed or was on the surgical rotations and really fell in love with the way that surgery worked, the way that you were able to evaluate a patient, to be able to determine concerns that the patient has, and then to go on to dealing with the problem right there, having an immediate fix to the issue. It wasn't until I got to my residency in general surgery when I realized that cardiac and thoracic surgery was where I wanted to be. Cardiac surgery includes any procedure surgery, maneuvers that are performed on the heart, the great vessels, which include the blood vessels that go in and out of the heart directly. Thoracic surgery is everything else within the chest, and interesting enough, also below the diaphragm as well. So the reason why I stayed at University of North Carolina, several reasons. One is to serve the great folks of North Carolina. One of the unique things about UNC is that it is a public hospital, and so we get people from all walks of life, all aspects associated with socioeconomic status. We see our prisoner patients, we see people who may not have insurance, we are folks who are very well off and well to do. And I love that patient population, that patient mix, that diversity really kind of encourages me to do further. In addition to that, I enjoy teaching with my involvement with our residency program to be able to take both medical students as well as residents and, to discuss, show them, and educate kind of the inner workings of the body, or patient management, or post-operative care, or some of the science behind it, and seeing the reaction that folks have when they get it, and they say, "Oh my gosh, this makes sense. This is pretty awesome." So I love that reaction when, to be able to kind of share the knowledge that we have. Something that I would like to have patients know about me would be that I enjoy listening to the concerns. I enjoy talking with them about the different options that they have in terms of management of the reason why they came to see us. I'd also want them to know that I would like to teach them kind of what's going on, and also walk with them in a pretty humanistic way through their process of managing a pretty stressful situation. I know it's pretty stressful when you have to go see a thoracic surgeon, typically, especially if it's kind of in a cancer environment or something of that nature, and want to know that we provide a humanistic way to actually manage that. We speak directly to the patients. I don't like to talk over patients or talk in some fancy doctor speak where folks aren't able to understand, but at a level where folks are getting it. And to also provide an avenue or an arena to allow them to be able to ask whatever questions they have that I could try to answer for them. And honesty, I will be honest with you. I may not know everything, and I will be honest about that as well too, but we'll try to figure out and see what's going on.